Hello, everybody. Welcome to the TDF Wellbeing Webinar. My name is Irena Piotrowska. I am one of the practitioners at TDF. I am an acupuncturist, and today I am going to present to you a technique called Meridian Exercise 3-1-2. It was the first thing I was taught in a university clinic where I trained for my degree in acupuncture. It was developed by Dr. Zhu Zhongxiang, and he made it freely accessible to all. Dr. Zhu explains that the 3-1-2 exercise energizes all the meridians. This is my little assistant. You can see all the meridians on the body there. And it promotes health. He claims that the daily practice of the meridian exercise 3-1-2 method for 25 minutes can keep people young and energetic, and that some people with chronic diseases have experienced a major improvement in health after 4 weeks of practice. I advise you to implement this exercise to your daily exercise. I will explain later on what I mean by that, for minimum 2 weeks to see if there are any benefits for you. Please note that all of your videos and microphones are switched off. No one, including me, can see or hear you, so please take care and do what feels right for you. TDF is a charity that relies on donations. Please give what you can. Now, make yourself comfortable and minimize distractions. And if you can turn your phone into silent mode, that would be nice. Have a glass of water. The guided part of this session will last around 20 minutes and include me talking you through the self-help acupuncture technique called exercise 3-1-2. It includes acupressure, breathing, and semi-squatting exercise. I am going to concentrate today on acupressure and breathing techniques. That's what I meant, that you can implement these two parts of exercise into your daily exercise. Do close your eyes if you feel comfortable to do so. Please remember to pace yourself according to your own abilities. You can stop and start at any point. The session will end by 12:30. So let's practice now. I will explain the theory while we practice. If you have any questions after this session or want to get in touch, please email us at therapysupport@tdf.org.uk. Please keep in mind that acupressure is a complementary therapy. Consult your doctor if you have any doubts. So let's move to exercise, meridian exercise 3-1-2. So there are 3 parts in this exercise. We will do acupressure and we will do abdominal breathing technique. The exercise part, I am leaving it up to you. Consult with your doctor what you can do and just stick to professional advice in that field. So in this exercise 3, stand for 3 acupuncture points that we are going to pressure. I'm going to measure the time, so we do this efficiently and we have enough time for everything. So the first point that we are going to use, it's called hegu in Chinese. It's in Western world, it's called large intestine 4. So it's located, let me see. So it's located between first and second metacarpal bone on the dorsum of the hand. The way to find it is locate the beginning and end of second metacarpal bone, and it's in the middle, it's located in the middle on the radial side, on the thumb side of that bone. So here we are. The other way to find it, when you have your hands like this, the other hand, use your thumb, just press the thumb at its horizontal bending next to the side of your hand, like this, and bend it there. This way you find this point. Now I will measure the time. So try to find it again. It's here. You can press it like this. 1, 2, 1, 2, 1, 2, 1, 2. Please continue pressing that point. You may want to do some massage. Try to stimulate this point the way you feel comfortable. If it's pressing, 1, 2, 1, 2. If it's massaging, clockwise, counterclockwise, just try to stimulate this point. We'll stimulate this point for 2.5 minutes. Please continue to do that. Just press and lift. 1, 2, 1, 2, 1, 2. Please continue doing so. This point is one of the most famous points in acupuncture. It can be used in many different health conditions. Just to give you an idea, I'll tell you some of the conditions that it is used for. Please continue pressing. So it has a wide range of applications. For example, headache, wheezing patterns, cough, loss of voice, facial conditions like toothache, facial paralysis, facial spasm, trigeminal neuralgia, nosebleed, chronic nasal sinusitis, inflammation of the temporomandibular joint, eye disorders, prolapse pattern, prolapse of rectum, prolapse of uterus, diarrhea, constipation, obstructed urination, any problem with urination, lack of breast milk, epilepsy pattern, hysteria, insomnia, palpitations, stomach pain. Repeat. Let's switch to the other hand. Let's find it the same way, just this way. Yeah, in the middle of second metacarpal bone, or this way. And we are here. 1, 2, 1, 2, 1, 2, 1, 2. Please continue doing so while I'll give you some more indications when to use this point. So I mentioned lack of breast milk, epilepsy patterns, hysteria, insomnia, palpitations, stomach pain, generalized pain, edema, urticaria, sunburn, difficult labor, stroke. So basically, this point is called a master point. I mean, not basically, but one of the uses is called the master point of the head. So anything related to head, we can treat by pressing this point. So it can be any type of headache, toothache, anything to do with sense organs. You can do this exercise. You can do acupressure to children. It's very effective with children. And with children, you would use the force just like when you are checking if the cake is baked, just a little force, or finger painting. That's the same kind of force you can use with children. With yourself, just stimulate it. You can use quite some force here. As you can see, it's partly nails, but still you can see the red area. That's how I do this on me, and that's how I know it works for me. So I use quite some force here. There is contraindication to this point. It's not good to use during pregnancy. It can induce labor. So talking from different perspective, it's very good during labor, during longer labor. You can use it then, but during pregnancy, avoid using large intestine for this point. So the second point we are going to use, it's called NA1. It's pericardium 6. So the way to find it, it's located on the anterior aspect of the foramen between the tendons. When you make a fist, you can see tendons. It's located on this line. Yep, here. On this line. Yeah, it's difficult to show, but when you make a fist in the middle, there you can feel space between two tendons. You place the 3 fingers like this. You're starting on the wrist line, and the point we are looking for is located just under the index finger. Switch to thumb and press. Press and lift. Press and lift. Again, I'll show you how to find it. You place your other hand like this, starting on the wrist line, and the point is here between the tendons. Yeah, and press. Press and lift. Press and lift. Press and lift. Do other kind of stimulation, kind of massage yourself, always with love, with care, sometimes with force. While you do that, I'll set the clock. While we do that, I'm going to tell you indications to use this point, and keep in mind that it's to give you a roughly idea. There are more indications, more health conditions that any of the points we are going to learn about today can be used. So it's good for vomiting, for stomach pain, hiccups, wheezing patterns, depression patterns, epilepsy patterns again, hysteria, stroke, insomnia, angina pectoris, myocardial infarction, palpitation, pain in the abdomen, chest pain, generalized pain, lack of breast milk, nodular masses in the breast, dysmenorrhea, irregular menstruation, morning sickness, restless fetus, carpal tunnel syndrome, initial stage of cirrhosis, problem with thyroid, night blindness, glaucoma. This point is well known or best known for pregnant women because it's very good in alleviating morning sickness. You can even buy armbands that can press this point. In general, this point is very good to helping when the movement is in esophagus in its different direction than it's supposed to be. So that's why it's vomiting, it's nausea, it's acid reflux, anything you can think of, hiccups, the same. It's like the wrong direction of movement. It's good general for chest, for the area of the chest, as we mentioned. Let's switch to the other hand. Now place these 3 fingers like this, starting on the wrist line, and the point is right between the 2 tendons, right here under the index finger. It's between tendons of the flexor carpi radialis and palmaris longus muscles. It's here. Switch to thumb. The thumb is the biggest finger, and I prefer to use thumb because then we have more possibilities that we are on the right point. Points in acupuncture are tiny little, and using with acupressure, we don't have to be precise. Don't worry about this. It's the area covered by finger. It's quite big. 1, 2, 1, 2, 1, 2. The other indication to use this point would be, I finished all of them. So we went to night blindness and glaucoma to tell you just a few conditions about this point. So it's located on the pericardium meridian. Pericardium meridian starts, let's see where it's here. So it runs on the hand. Yeah, let's start from, I'll show you on myself. So it runs here, it's a bit difficult to show on myself, and it ends by the breast. So it can be used for local area, as I mentioned, carpal tunnel syndrome, or the chest area is very good with problems appearing in chest area. Now we are going to move to the 3rd point that we are going to use today. The 3rd point is called dessous knee. It's located below the knee. Let me show you. Okay, so how to locate it? It is located below the knee. You can find here depression under the kneecap. There's these 2 depressions. So place your hand, starting from index finger, on the line connecting these 2 depressions. This point is located below these depressions, hand width below. So find find the tibia, anterior crest of tibia, and it's located lateral to the anterior crest of tibia. If you could use your middle finger, just slide through the crest to the side, and the point is right here next to the finger. So let me do that again. Find the depression. It doesn't matter whether you are sitting or laying down. No, you can't really lay down, but if you have straight legs, it's even easier to find the depression. Place your hand like this, right under the hand. When you slide from the tibia crest, the point is here. Please continue pressing this point while I'm going to, it's best to use the other arm to do so. So the stomach 36 is another well-known, famous point in acupuncture. Actually, in this pandemic, my supervisor from clinic that I graduated from, I trained there for my acupuncture degree. He told us that this point is used every day, will protect us from the pandemic, will help to strengthen our immune system, not protect us, like keep us immune to it. It will help us. It does stimulate immune system. So the other indications for this point, like press 1, 2, 1, 2, 1, 2. The other indications for this point are diarrhea, appendicitis, acute intestinal obstruction, stomach and abdominal pain, hiccups, prolapse of the rectum and uterus, insomnia, headache, vertigo, epilepsy, mania patterns, withdrawal patterns, amenorrhea, irregular menstruation, sudden blindness, ptosis, edema, obstructed urination, impotence, facial paralysis, jaundice, acute pancreatitis, initial stage cirrhosis, urticaria, eczema of the lower limbs. So just to give you an idea. You might have heard about it, but in Shaolin Temple, this point is used every day. So now, now when I think about Shaolin, I don't see kung fu Hollywood movies, but I see this point. It's very powerful, and this point is partly responsible for the monks' superpowers. Let's switch leg now. The other side. Find depression. Oh, it's better this way. Find the depression. Place your hand underneath, on the line of the depression, and the point is right below the hand. You slide from tibia crest, and it's here. One finger width away from the tibia. So let's press this point. And the presses are the same. 1, 2, 1, 2, 1, 2, 1, 2. Move it this way, that way. So there is this ancient saying in China that pressing these points, Hego, large intestine 4, Neiguan, pericardium 6, and Jussanli, stomach 36, once a day keeps disease at bay. The man who developed this method was sickly. Now he is in 3 years, he will be 100 years old. He is still active, not only physically, but he is working all the time. And he says that was his goal. He wanted to live and work till he is 100 years old. So I strongly advise anybody to use this method every day. If anybody has some chronic or acute disease, do this. But what I love most about acupuncture is that it is great at preventing diseases. So these 3 points will keep your body energized and will prevent you from being sick. So it's good for everybody. It's good for children, it's good for adults, it is good for someone who is healthy and someone who is not that healthy. I hope any one of you can reach these points, and I hope anyone will implement this method into everyday activities. The founder and his wife says that the way we need to eat and drink, they feel need for doing this exercise. So please continue doing that. We are going to move now to second part of this exercise, meridian exercise. So the second part is about breathing. What I would like you to do, sit comfortably or lay down. It's easier done when you are laying down, and I will show you what to keep in mind. So first, concentrate on dantian. It is a point located between the umbilicus and pubic bone, and it is the point of energy, sea of energy. So concentrate on that when you breathe. Try not to use your chest. Don't move your chest while you are breathing. Breathe only using your abdominal muscle. So concentrate on dantian. Don't move your chest, and breathe with your abdominal muscle like this. Please continue doing so. I want to explain to you, it's best done when you are laying down, but I don't find it difficult to do this exercise when I'm sitting, when I'm in public transportation. This is where I do this exercise because it's a perfect place. So you can do that sitting or laying down. Feel comfortable about it. Remember, concentrate on dantian. You may close your eyes to imagine this flow of energy into your abdomen. Don't move your chest. Use your abdominal muscle. Why it is important? Just have a look at this model with acupuncture, with meridians and acupuncture points. So by using your abdominal muscle, you are activating all these meridians. There are 9 of them. The Ren meridian in the middle, kidney meridian next to it, and then the stomach meridian, and then the spleen meridian. Please continue breathing. What it does, it's activate them. There is another saying in Chinese medicine, and the saying is that the roots of diseases are in meridians. So by cleaning, activating, moving energy through meridians, we are helping battle the disease. And it was known in ancient China as well. It was known then that control breathing, control abdominal breathing, influences, clears the channels, the meridians, and it helps build up the health. The last part of the exercise is semi-squatting. I'm not going to demonstrate it. Please implement these 2 steps, acupressure points and abdominal breathing exercise, to your everyday exercise. You can do this while commuting, you can do this in the shower, you can do this before falling asleep. Abdominal exercise helps with insomnia. It's really effective, but it probably won't work just first day, second day, but give it time. It builds up and it helps, only it needs some time. We are almost there with time. So thank you everyone who participated today, and please attend again. Please also tell your friends and family if possible, and if you like the session, please support the charity's work. I know that I may be talking to NHS staff, and so I would love to use this opportunity to thank you for your work. I really appreciate it. Next, Team TDF Wellbeing webinar with me will cover self-help acupuncture for onset and later stages of diseases, of infections. Sorry. I hope to see you there. Thank you for your time. I hope it was helpful. Please contact us with any question and feedback. Stay healthy and happy. Thank you.